Our blood is mostly made of 4 things: red blood cells, white blood cells, platelets, and plasma. They each have an important job to do. Red blood cells bring oxygen from your lungs to the rest of your body, and they are the reason your blood is red. White blood cells help you to fight infections. Platelets help you to stop bleeding and protect you from bruising. Plasma is the fluid that helps these blood cells and platelets move through your body. But where do red blood cells, white blood cells, and platelets come from? Bone marrow is the spongy stuff inside your bones which makes stem cells. Stem cells are young cells which become red blood cells, white blood cells, or platelets when they grow up. Did you know this only takes a few days for white blood cells, or at most a few months for red blood cells? Sometimes the bone marrow can't produce enough of these stem cells. This is never your fault. We can't always work out why this happens, but when it happens, you have something called aplastic anemia. How will aplastic anemia affect you? Without enough red blood cells, you might look pale, feel tired, and out of breath. Without enough white blood cells, you might get infections. These infections can make you feel poorly and grumpy. Without enough platelets, you might bruise easily or bleed without having a bump or an injury. Or you might not notice that anything is different, but you may not feel like your normal self. How might you get better? Lots of people will be involved in helping you, and there are different things that they can do. One way to help you is by getting healthy blood into your body. This is called a blood transfusion. Another way to help you get better is to take some medicines called immunosuppressants. You might have a treatment called a stem cell transplant. This is when you receive new stem cells. When your new stem cells enter your blood, they will move to your bone marrow and start making new blood cells and platelets. Do many children have aplastic anemia? No. There are normally about 40 children each year in the UK that are diagnosed with aplastic anemia. This makes your condition rare, but there are lots of people who are very used to looking after someone just like you. What can you do to help yourself get better? Ask lots of questions about things you are not sure about. If you feel worried or cross, talk to your family or your friends. Eat a healthy diet of foods that are considered safe for you and take your medication. Always remember that you are not alone. There are other people with aplastic anemia all over the world, and lots of them have very happy lives. So, keep living your normal life as much as possible. Do as many of the things you enjoy the most and keep talking about how you feel. For more information, talk to an adult about calling our helpline or visiting the Marrowkids area on the Aplastic Anemia Trust website.